Good day, my dear undergraduate exam going students. Welcome to Open Book Review. Rapid revision. I would like you people to have your books open and follow whether you people can trace what I am saying is there in your book. Otherwise, find out the source for it. Predominantly, it will be in your book. Don't change your book. However, these are my references, and R.A.T.S is something that is accessible to all of you people. The topic that I'm going to cover today will be tuberculosis and syphilis in infectious diseases. One dictum before I start. In pathology, the infectious diseases must be having a pathological pattern, grossly or microscopically or both. Only then it becomes our question. Otherwise, it is pure microbiology. So this is tuberculosis. As I told you, not only you, I am also picking up the book. So what is the causative organism? You people should be familiar with the terms hominis and bovis. And what are the roots of infection? Pathogenesis, you people should be knowing how a granuloma is being developed, and it is basically a type 4 hypersensitivity. The development, there will be a series of pictures in your book. Robbins has given other books also. I would like you people to kindly trace them. Mark it. Then there are two main lesions in tuberculosis. One is called a primary tuberculosis, another is secondary tuberculosis. See whether it is there in your book. If you have found out, good. The primary tuberculosis in the lung is called the Gons focus. So there's a Gons focus subpleural in location. Upper part of the lower lobe, lower part of the upper lobe. Together with this, the lymphatics and the hilar lymph nodes will form the primary complex. So primary complex can be a question. And what are the differences between primary and secondary tuberculosis? I have given in a tabular column. I would like you people to go through it. And regarding the etiology, there are some conditions which can predispose. Diabetes, for example, administration of steroids, malnutrition. A lot of conditions I had given. Kindly go through it. It gets inactivated, the primary one, but later on it can get reactivated. This is called as reactivation tuberculosis. And in the adult age, what happens is it gets located in the apex. So this is secondary tuberculosis because of high oxygen tension. So what are the lesions that you people get? It can be consolidation, it can be cavitation, etc. How they will grossly appear? Ragged edges and the inner surface. Miliary tuberculosis, very frequently asked question. And this will be forming part of the answer also. Miliary means millet seed-like. Go back and see. Hardly about 1 millimeter, and it is called as miliary because it resembles canary bird feet. See whether these words are given. And the types of miliary: primary miliary, secondary miliary. And the routes of spread can be by means of the veins or the lymphatics. When it is going to be one, it can be only a pulmonary miliary, or when it invades the systemic one, it can become a systemic miliary, including the lung. So miliary tuberculosis is one. Sometimes you can get isolated organ by means of hematogenous spread. Bone, for example, osteomyelitis. The modes of spread you people should be mentioning. The classical one will be the granuloma. Wherever there is tuberculosis, you should explain the granuloma with diagram. Remember, epithelioid cells, lymphocytes, fibroblasts, caseous necrosis, Langerhans type of giant cells. See whether the diagram is there. What is the clinical presentation? Don't waste too much time on it. Low-grade fever, loss of weight, etc. Ascites can be present. And what are the complications of tuberculosis? There can be a bronchopleural fistula. There can be a meningitis. There can be an osteomyelitis. All this will be given. The entire list. Don't write only what I'm saying. I want the entire list of complications that can be there. And having said that, what are the methods of diagnosis? Investigations, starting from the acid-fast stain, sputum examination, culture in Lowenstein-Jensen medium, up to the PCR, polymerase chain reaction, you people will have to mention. What are the special stains? Not only the acid-fast stain, I would like to have Orman rhodamine stain also. Why is this topic important? It can come as an essay, short note, many multiple choice questions, viva definitely specimen, and questions. It can come in general pathology because of infections, systemic pathology because of respiratory system, and the bone also. What are all the differential diagnoses of granuloma? The diagram, as I mentioned, even for gross as well as the microscopy. And what are the other systems involved? Complications. For example, infertility is a common complication because the fallopian tube is obscure. Pot spine. These are all questions even in other subjects. I will not confuse you right now. We will see the variants when we go to the respective systems. So this is an essay question. The next question is syphilis. Earlier, if you know syphilis, you know medicine. That is the saying. So in syphilis, what is the causative organism? Treponema pallidum. How do you see it? Dark field microscopy. What is the etiology of it? What is the structure of the spirochete? See whether you are there. And the stages starting from the chancre, primary, then a secondary, there is a latent, finally it becomes a tertiary syphilis. What are all the various organs involved? You get even an aneurysm and you get aortic incompetence. In the brain, you can have general paralysis of insane. So these things you will have to know. The classical lesion grossly will be the gumma. It can occur in testes, all the other places. Sometimes perforation of the palate can be there. In the skin, there is a coppery red rash which is symmetrical. So these are all various lesions which you people will have to mention. Congenital syphilis is asked as a separate question. Moon's molars, Hutchison's teeth, and pneumonia alba. Sometimes there can be a dead fetus, a stillborn fetus. So what are all the abnormalities? See whether you are able to find out. And what are all the investigations starting from VDRL, etc. What all can you people find out? Microbiology and pathology will overlap. And these are my references in pathology. Kindly go through it. It brings us to the end of this particular session. Thank you.